Hi and welcome to Wellbeing Wednesdays. I'm Nurse Rachel Devereux and today we're joined with Chantal. I always make this up, Nogbou.
That's close. Nogbou.
Nogbou.
Much easier than it looks.
I think I have to phonetically say it so that I remember where to find you when I'm typing your name in. Who runs an acupuncture clinic, a mobile acupuncture clinic, and she's going to help us with our health and wellbeing session. So these sessions are weekly wellbeing sessions with guest speakers on one of 4 topics. We've got health and wellbeing, parenting, pets and hobbies, and business. And I run them either at 12:30 or at 8:30 p.m. because I have a life and I don't always want to be working at late at night. They go out onto YouTube, so if you're watching as a replay, please put in the comments whether you've enjoyed it or not. We have ground rules for our guests in-house. Sadly, these ones don't read them, so I apologise for them. But the general rule of thumb is no rude behaviour, mute and less speaking, share the YouTube link, share the business social media. The content is given by the owners of the businesses that I'm inviting, and they're giving this for free. So it is so nice for you to share this with your friends, to raise the profile, and as small business owners we really do a little happy dance every time we are booked. If you've enjoyed it and you want to get in touch and have an appointment, Chantal does work mobile and she works virtually as well. You can get in touch with her and say just thank you. I'm sure she'd really love that. You could also buy her a coffee or buy any of her products. So don't just think, oh, that was nice, I'll give it a like. Really go that extra mile if you want to. Personally, I have a Ko-fi account which supports my newly formed parent sanctuary, which helps parents with mental and physical health. So my link is on the screen now, and it's really easy, kofi.com/parent sanctuary. So who am I? I'm a mum of 4. I've got twins that are approaching a year. I'm a nurse, a transformational coach. I am trained to go into schools and deliver my mental health rock sessions. So that's primary, middle and high schools. I'm a sling librarian with Sling Library, and that means that I hire out baby slings, and I've just ventured into doing postal hire. And I help homes become chemical free because it's all part of wellness. So with Parent Sanctuary, we're currently running nature walks for wellbeing, and we do sort of a crying, colic and allergy clinic as well, which is very much hand holding and helping people come to terms with ways they can help their baby settle. So moving on, I want to remind us to breathe. I have to remember this myself because running these sessions I end up talking too fast, forgetting to breathe. So I'm going to bring my shoulders down from my ears. I'm going to readjust my posture so that I'm sitting comfortably, and I've got space to inflate my lungs. Now, what I teach all of my clients is how to meditate in a moment. And this is because our thoughts are flying through our brain all the time. And it's very easy to get swept away with them. And as a busy mum, I can rarely find 20 minutes to sit and meditate. So what I've learned is how I can use a single breath to recognize where I am, what I'm doing, and what I want it to feel like. This helps me switch my fight, flight, or freeze so that I am able to respond in a way that is calm and caring instead of snappy, short, and potentially aggressive. So I really want to. Is it real? Do I really need to be mad with this? Is this actually something that deserves that kind of response? And you know what? 99% of the time, it's really not. So if we enjoy that breath, and then we'll move on to Chantal. So I'm going to stop share and let you be center stage. And I'm just going to mute at my end in case it gets loud here for any reason. And yeah, tell us about yourself.
So just as, like, if there's any noise, it's just the time where people are cutting the grass outside. So if there's any like noise, it has to be like right now. So I'm Chantal. I am like Rachel, a mum of four, and my twins will be 10 in November, and I have an almost 16-year-old and an almost 19-year-old. Like, I don't feel old enough. And I am an acupuncturist, and I have been an acupuncturist since 2012. I conveniently had my twins 6 weeks into my final year, as you do, but I managed to still graduate. And family health and well-being is a huge, huge passion of mine, always using natural techniques with my own children. So I originally became a holistic therapist 15 years ago. So always started using massage and aromatherapy and reflexology with my own children, and then became an acupuncturist and started to utilize some of my skills with not just my family, but also starting to use the techniques as recommendations, I guess, to my friends and family, to their children, and even themselves. And then one of my girls, when she was born, she had really, really chronic constipation. And she was literally going an active birth position to deliver a poo, and it was literally, she was delivering a massive poo. And I really wanted to find out what was the best way for me to treat this. And I had, obviously, as an acupuncturist, resorted to using the needles, which surprisingly children are absolutely loving the actual acupuncture, the actual needles. But there is so much that we can do with our children in forms of pediatric Chinese massage called Tui Na, but also acupressure. So I started to use this with my own children, and it's incredibly powerful. You know, children react incredibly quickly to energetic changes, which is what the acupressure does. So things start to shift very, very quickly. So as an acupuncturist, if you don't know much about it, it's really the insertion of needles on any of 365 points dotted around your body. To have my little, she's not so little anymore, excuse the dress, because this was the lady with the boobies. It's my acupuncture model, but my girls were getting a little bit, you know, she's constantly staring at us with no clothes on. So we have just fabricated a little knitted dress for her. But she has, if I hold her very closely to the camera, she has some lines and dots on her face, and this is where the acupuncture points are. And acupuncture works on the system that we have energy running around our body, and energy as well as blood is one of our life forces. And when we become stuck or stressed, this is our energy becomes stuck and depletes when we burn the candle at both ends. And using the acupuncture, we can really help to clear any blockages, but also rebalance the body. And it's not just rebalancing the body within the physical side of things, so dealing with pain, but actually also dealing with the emotional side. And that works amazingly well in newborn babies to our great grandparents. So when I do acupuncture, as Rachel mentioned, I have a mobile acupuncture practice, and I travel out to people and I treat them in their own home. It's incredibly special to heal in your very own environment. You know, you are safe, you're in space where you feel most comfortable, and it really adds another layer to the treatment. Then when you have, you know, your children around, your partner around, your pets around, it really adds another dimension to that. What if you could really learn the skills to use yourself on you, your partner, or your children? Like, how amazing would that be? So, like Rachel mentioned before, I also teach I offer virtual sessions, which generally is done on a one-to-one basis, where we go through a consultation, we figure out, okay, what is it you need? What are you needing help with? And I teach you a very, very specific acupressure routine. So you can really take this and start changing your routine for your self-care. You can incorporate these little things in your skin care, you know, putting cream on after you've had a bath. Start incorporating these acupressure points and really start seeing the shifts. And being able to do this for yourself can be so incredibly empowering, because you are taking full control over your health and well-being. Whereas very often within the Western world, we are very led by, well, our doctor says, our nurse says, the doctors prescribe this. But when we're actually doing something that we know can create a positive shift in ourselves for our health and well-being, that's immense. That's incredibly powerful and empowering. So I am going to be launching, if Rachel doesn't mind me mentioning, otherwise you might have to cut it out. I am actually launching my 6-week Nurture Family Wellness Program this month, which will be 1 hour Zoom session a week. Every week we'll cover a topic. So we have 5 weeks of topics. So we have sleep, colds and coughs, digestion, fever, and anxiety. These are our 5 topics that we'll cover, one topic for 1 hour that week. I will talk to you all about what this is, the red flags, like when do you need to actually get help from your GP or A&E or whichever. But I will also teach you natural medicine techniques. So I will cover acupressure, I will cover Chinese massage that you can use. I will cover some other things like aromatherapy oils, but that hour is to really give you the tools and techniques. If your child or yourself or somebody in the family comes up with that condition, if somebody's struggling with a cold, you're going to know what to do and how to treat it. And the 6th session will be all about consolidating, so you are ready to go out there and you have the skills in your backpack for your self-healing, but also your families. So that's going to be incredibly exciting. It's something that I've wanted to do for years, and I used to do in person before life got in the way. But it's incredibly powerful. You can see amazing shifts by just using acupressure. So acupressure is using the same acupuncture points, but just using like your thumbs or your fingers, or even the end of a pen.
I am so incredibly excited about this. We have to talk. But yes, get booked on that. And I'm very, very excited about that, Chantal. So
going to be amazing.
Whilst you were talking, I was thinking, Diana, she did us an Indian head massage when she came and did her slot. And that idea of being able to self-care. At this point, I'm getting used to the whole YouTube thing. Go back and watch one of my other videos. I really should get the 6-year-old to tell me how to do this. Just click on this link here. I don't know how to do that, but look for it. There's one where there's Diana.
Link there underneath. Check out all the videos below.
And she did like the Indian head massage, and I was thinking, actually, what do I have right now? And I know exactly why it is, but my old injuries come up. So I was sat here thinking, I could just that bit just there. So it's things like that you can help with people, that they know where to press in order to help relieve tension.
Yeah, so it's really giving people the tools and techniques. So it's like, well, actually, there is a real tightness there. And I actually did a masterclass on Monday night, and it was all about how to tone your vagus nerve, which you probably know lots about. And like you and I probably know that it's the longest cranial nerve, and it's very important for our inner balance, our well-being, you know, our the way that we sleep, the way that we relax. And the more we tone, the easier it is to really go into that meditative state, you know, to relax and switch off. And obviously the vagus nerve runs, not obviously, but it runs just in front of you, your side muscle there, your SEM. But when you just tone that muscle, when it feels tight there, to actually work all the way down from underneath your earlobe to the front of your collarbone, that can actually really help relax all those muscles. So just a gentle stroke at the just squeezing the SEM, the sternocleidomastoid muscle, just there, can really help relieve all the tightness, as well as tone the vagus nerve. Do you know where it is?
Yeah, I'm just thinking, where does
it's just there.
So I'm hurting deep underneath my collarbone, but I know that I have I had a whiplash injury, and I know that when I get stressed, and when I've been burning the candle at both ends and not looking after myself, then my body reminds me to slow down by bringing that tightness back. And I guess, like other people, I used to think, oh, it's I've slept funny on it, and I wouldn't connect my day-to-day life with the fact that my body knows how to make me sit down, how to make me relax, how to make me take care of myself. And I would have perhaps pushed past that, and I would have continued on, just maybe taking some pain relief and trying to continue working through it instead of addressing what my body was telling me. I'd get an ache, and I'd push through it, and then I'd get an illness like a cold or something like that, and I'd push through it, continue going to work, and then I'd get something that would stop me going to work, and I'd just say, oh well, I'm always feeling ill. And now I recognize that my body's talking to me earlier, and I don't go through that cycle the same as I used to do. I am taking better care of myself as well. Like, I take better vitamins, I'm definitely eating better, and definitely hydrating better. But part of this I've recognized is that if my body talks to me, I listen.
And that's important, because I think a lot of us are quite disconnected with our bodies. But by doing, you know, something as the self-care Indian head massage, you know, like what Di showed, or even learning how to do acupressure, it's really about listening and noticing the little shifts in your body, you know, the very small things that are suddenly different. And you start to be tuned in a lot more to your health, so you know what your body is saying, rather than before. I love that saying where they say, you know, listen to your body whispering before it needs to shout at you. And it's like, listen to the little things that are happening, you know, like, oh, my neck feels really stiff, rather than wait for it to completely seize up and you're like, oh my God, I can't move. When it starts to feel really tight, or you are like, oh, that feeling went crampy, that's your body telling you, like, slow down, stretch, you know, like you say, like, take that breath, you know, take that time to just stop and I am going to take that breath. It's just knowing and recognizing when your body asks you to do this.
Yeah, it's it used to be a lot more common to be able to listen to your body, but we handed over health to people in white coats. And we sort of missed that their sickness, they treat sickness, they don't treat health as well. And when I worked in the NHS, I felt like I was firefighting all the time, and there was a lot I could have done that was proactive, that was beneficial for recovery, and yet the firefighting needed to happen first. I couldn't do any of the proactive whilst the fires were still burning. So that's one of the reasons why I do feel now I'm making more of an impact, I guess.
Yeah. Because that's, it's not about treating what's going on right now, but actually preventing it from happening again, or reducing the chances of it happening again. And I think that's the real thing with, you know, giving people tools and techniques, and, you know, making sure that they're reducing the impact and the stresses that are around them, you know, so they are making the best decisions for their health.
So as a little taster, is there anything that you can show someone that's not going to mean that they can't join your course, because I want everyone to do your course, but is there anything to sort of understand what's going to be asked of them other than listen to you for an hour a week?
Well, it's not really going to be listening to me for an hour. I think the really important thing is it will be done through Zoom. So you cannot just see me, but I want to see you do the actual techniques with me, because it's important that when I teach you something that is actually Chinese medicine, that you know how to do it right, and you know how to do it safely, and you know exactly where to apply pressure for these acupressure points. So it's going to be very much a, you know, there is a lot of theory involved, because I want you to know why you need to do what I'm going to ask you to do, what I'm going to show you how to do. But, you know, it's just as important that you know how to do this as well. So it's very much also a practical session. But one of the things I guess I could show you really easily, like, what shall I show you? Right, so allergy season is coming up. I know we've had this, exactly, Rachel knows what's coming. You know, this is the time where people have blocked noses because of, you know, the weather outside, or, you know, the stuffy radiators, but also when the flowers, it's beautiful with all the flowers coming up outside and the blossoms starting to come on the tree, but actually it's really aggravating for a lot of people when they have allergies, seasonal allergies. So a really, really lovely point is just on the corner of the nose. And this point, you could either just apply pressure, or you like static pressure, or use circular pressure. And when you use circular pressure, you can almost feel your nasal passages opening when you do this, when it feels quite blocked. And as you're doing it, you can either work your way back up the nose to the inner corner of your eyes. That really helps to open that nasal passage. And this point particularly is all about opening the facial orifices. So any of the sinus areas within your face will be opened and cleared. But when you incorporate the point just on the inside of your eye, but still on your nose, that is actually amazing when your allergies are starting to affect the eyes, when you get really irritated, swollen red eyes. That's an amazing one to do. Obviously, before you do any of these techniques, make sure that your face is clean, your hands are clean, like use hand sanitizer, but be mindful that you don't get your fingers in your eyes if you just put hand sanitizer on, because that's going to sting more. But that's a really, really lovely thing to do. So as a preventative, start this now if you get hay fever. So as a preventative, start using this now, because it will build and it will strengthen your immune system. So you can cut off the hay fever symptoms, or, you know, you can prepare them. You can prepare so they're not going to be as severe as they might have been last year. So it's just a very quick and simple thing to do. I say do this every day as a preventative at the moment, maybe for 2 minutes. 3 minutes or longer if you like to do the facial massage with it at the same time. If you feel like it's very much in your cheeks, You can circle underneath your cheekbone and then get it out towards your glands underneath your ears. But that, I think, is a really perfect acupressure point to really try with. See what happens, you know, apply the pressure. It's nothing heavy, it's nothing strong, just slight pressure, static pressure or circular pressure. Breathe in as you're doing it and slowly breathe out through your mouth, and you can work your way up again, just circular pressure, and feel how much wider your passages are, how much easier it is to breathe in. And people often go like, oh, somebody's just opened a little valve and I can suddenly get fresh air into my sinus. So when I do the course, it's going to be bits of this, but lots more. So it's not just going to be one, it's going to be a few different acupressure points, also incorporating some Chinese massage and bringing in some essential oils and everything. So you basically have access to my brain for that hour. So anything that I know, which is actually like shed loads of stuff, you have access to it within the hour. So you're like, oh, you know, like when I get a cold, it's really like this. What should I do? You have access to my brain for that time. So it's all very exciting.
Fabulous. I'm really excited about that. I had I think it was like a 15-minute session with you for hayfever, the actual needles, and I believe that lasted for at least 2 or 3 seasons. It was a really long-standing effect that I got from just one session with you. And I know everybody's different and everyone's going to have different results, but that was a real big difference in my life, not having the hay fever symptoms. And the other thing that I do is use the Enyo iPads to help keep my eyes clear, and obviously my hands as well. But if I start feeling that itchy eyes, if I get a cold water on my Enyo iPads, it helps clean any pollen or any irritants away from my eyes, but also cooling and soothing as well. So I'm glad there's 2 in a pack, because I just put them on and gentle, not even pressure, just gently removing anything that's on or around my eyes to try and stop them from streaming. Hay fever, when I get it, I can't think straight. I get brain fog. I feel dangerous driving if I've taken histamines. I feel dangerous driving if I'm suffering with symptoms. I get really, really bad with it. So finding a way that was non-medicated that helped me to just get on with my life was so good.
And it was literally a taster session in that open evening event, or that pamper event that we had, which I guess was like 4 years ago.
Oh, I think it was 4 years ago, because it was at the
fire
station that Agate had set up for us. So yeah. I still remember like the effect that had. That was amazing. Just what I needed.
Just what you needed. It was pretty amazing that day.
So pass me your details. We'll get them in the chat box below. I know where to put that one, and we'll let people know how to book onto your course. I'm just going to close off here, because I know that watching YouTubes can feel like they're taking a long time, so I'll try and keep them reasonably short. So if I just tell you a little bit more about Enyo, I did mention it there. It is a 100% carbon neutral cleaning system that uses a one-of-a-kind pore deep clean instead of chemical cleaning. We use cold water and specially designed fibres, and cleaning's 6 times better. It's healthier, it's more cost effective, and it's easier. So people who've got joint problems really, really love Enyo because they can do their own cleaning and they're not reliant on somebody else. It is available to buy from as little as £16 for 3 years worth of makeup removal, and the eye thing that I've just mentioned. I do have a brain in here. So you could use it for makeup removal, cleaning hands and faces, even onion sting. If you're chopping onions, I've used it to take that cry out of my eyes from onions. We have it as a business that you can join. It could be a stopgap or a new career, and that's joining from £99. It is a totally different way to clean, and some people do understand it in one meeting with me, but most people benefit from attending around 4 demos, and every time I run a demo, people learn more. And even the people who've been using it for 3, 6, 10 years, they're always happy to attend the demos because of what they learn during them. I'm not a one-trick pony. There's so much more that comes through my demos than just how to clean your home. And you don't have to clean your home all the time, because I'm very much about helping you have an easier life. My challenge that's running at the moment is to do March, which is 30 minutes of outside time every single day in March, and find one thing of wonder. So if you'd like to find out more of that, or if you want to just get involved, all you have to do is hashtag March on your social media platforms and share that Parent Sanctuary are helping people get outside for half an hour a day. It's a bit of a social challenge, a bit of togetherness, even though we're apart, and it's really, really lovely. Thank you for watching. Don't forget to subscribe.